Okay.
Okay, you can start, sir.
Hello. Good afternoon and good evening, everybody, elect members. I think we are all celebrating our Independence Day. Yes, after 75 years, we have progressed very well, very well. There is no doubt in that. With this population and beginning from the zero level, we have achieved many things in many fields, multiple fields. Of course, politics are there. Let us ignore it. We are not considerable. As a citizen, we must always cooperate with the government because we have chosen the government. We have chosen the persons to whom should govern us. Because we know they go by the Constitution. Everybody protects the Constitution. Yes, of course. This is how it began. With all these borders, we are safe inside. Only thing is, we must make hard attempts, whatever be our position, and try to make our living. Yes. I told you long back, about 4 months or 6 months back, when a new apparatus has been discovered for the detection of ailments in the body. At that time, I told every one of you in the elite group meeting, a day will come that we'll be asked to go into the room. We'll be asked to go into the room. They'll check up the whole body and precisely find out what is the problem. 99.9%. That has come true. The apparatus has been discovered and they are manufactured. Tests are going on. They say we'll be asked to go into the room. Every nerve, every cell, every organ is being detected, scanned. But what is the advantage is, it is less radiation. Less radiation. Thank God we are getting it soon, but I don't know what is the cost when it will come to India. Of course, scientists are so advanced. But one thing I am very much sure, when such an examination is done, then result will differ from person to person. From person to person. No doubt in that, no doubt. That is our philosophy. That is our philosophy. Every person is different because of his thinkings, likes and dislikes, his atmosphere, surroundings, his understanding. So he can show different symptoms in his disease. Yes, sir. You coined them as one disease. What the difference? No, not that. I am telling you about homeopathic way. What it does, though the disease may be called as one, the symptoms differ, and after totality of symptoms, you find a different medicine for different problems. So, medicine also differs from person to person. This is what Hahnemann has been telling time and again. No doubt in that. The modern investigations, modern approach, everything will come to this aspect only, because we treat only the mind, not the diseases. Diseases have an impact on the mind. Diseases go into the root of the matter, like his habits, atmosphere, surroundings, etc. Yes. For this, I take one simple example. We have got patient with piles. After considering their unique symptoms, the medicine differs. How, sir? Disease is same, piles is same. We generally say bleeding piles, animal is using piles, acid nitric, etc. Well, the piles means if the medicines are given, the ascorbic acid is given, it is gone. It has to act because it is a proven medicine. I do it. But we go deep into this homeopathic way of treatment. What is that? Supposing piles with burning sensation, with chilly sensation in the body, asthma in childhood, you give him arsenicum album. Piles with burning sensation, bleeding, chilly, he desires ice cream, phosphorus is given. Sir, if phosphorus is given, then everything is all right. No. You have to give your exclusive potassium and piles, phosphorus, as the case may be. Piles, itching, burning, bleeding, pain in the rectal region, throat aggravation. When you quote the throat, aggravations begins in the throat. That is pain, irritability, discomfort, difficulty in swallowing, etc. Lactasis is the best medicine. Lactasis is a main make poison. Piles, dryness of rectum, thirstlessness, sweet desires, right side sleep, lycopodium helps well. Piles, fastidious, cleanliness mania, restlessness, arsenicum album. Piles, sympathetic, friendly, cheerful, traveling desire, phosphorus. Those who travel frequently, those representatives and company agents, whose most medical representatives, they all used to go to, they travel every day. So for them, phosphorus is the best medicine. Piles delusion that he is a king, he is a king. Egoism. I know everything. He cannot do anything with me. He's a fool. Delusion of wealth in front of you, in front of me. And you are nothing. I know about and I know knowledge about money. This used to happen in our times for some days, because if somebody earns 1 crore or 2 crores, previously 1 lakh, after before 10 years or so, today 1 crore is the minimum target. If you reach 1 crore, you call as a crorepati. So egoism comes because you started living comfortably. Then self-determination. Piles, menopause, loquacity, dreams of dead people, dreaming about snakes, etc., etc. God blesses me, and wherever I am, dream come true, etc. Some feeling. I have been dreaming myself. Let the God bless me from evils of this dream, etc. Jealousy, lackadaisical comes. Now, to understand the difference between the pipes, that is homeopathy. No doubt in it. Along with the indicated remedies, which is mind symptoms and likes and dislikes, etc. taken into consideration. The medicine indicated therein is given. The prognosis or true false, like this, for every disease, we have got approach, how to prevent them, how to make them normal, etc. Yes. Then we'll go to some other topic. Yes. I have many things to tell you, but I don't want to confuse you more. Yes. We all now had a graphic description of the injury, either bone injury or muscle injury or skin bruises. We know about these medicines nowadays. Most of you know medicine theory, because we have also been giving those medicines whenever you come across that. What is an injury? Injury is defined as a wound or damage to a living tissue. If the damage is caused, it cannot function. If it is not attended with proper medicine or the application of medicine, it will get damaged. Then it becomes fungus. It becomes gangrene. Injury including bones and muscles, tendons and ligaments. They are all the main things. General simple injuries we can treat. For fractures, acute injury, chronic injury, you can divide it. A sudden severe injury such as a fracture or sprain is an acute injury. How it is defined as acute injury? Because it will take so much time to get it cured. It has happened suddenly and it takes time to cure. What is chronic injury? A long time repetitive injury such as tendonitis or stress fracture, etc. Supposing there's a fracture. In the fracture, you are admitted in the hospital. No other way. You have to go to compulsorily, you have to go to the hospital. Either modern hospital or the traditional method of treatment, etc. Even they have followed this medical phenomenon procedures. They also learn the medical system, MBBS, they undergo. But when coming to application of medicine, they give their herbal medicines, make the famous Puttur bone centers. They are very much available in Chennai. I don't know about other places. In Andhra they are available, but they apply herbal leaves and egg yolk, etc., make apply the things. They also advise us to take Symphytum homeopathic medicine. Yes, I've heard one MBBS doctor specialized in bones and nerves and etc. When I traveled with him by the same time, accidentally, he told me that Symphytum homeopathic medicine is the best one, along with their herbal medicine. Here, now understand, when a fracture is there, you have to go to hospital. Nowadays, it is very simple in the allopathic way. They put shields, the stainless steel materials, put rods, put screws, and they stitch. They pack the damaged parts with medicines and stitches them, and we are asked to take 3 days bed rest, and from 4th day they ask us to go to physiotherapy. Every hospital has got physiotherapy. The physiotherapist comes in at an appointed time. He helps us to walk. In most cases, they will give pressure and see that we walk within 5 days of injury. Previously it was taking months together because they have not been using these metal parts, screws and the plates, etc. Nowadays, after application of that, the doctor says, 5th day you have to stop, walk. 5th day you have to walk. Of course, for shoulder injury, you have to keep it alive and you have to make it after every 4 hours or 5 hours, you are asked to take the physiotherapy exercises. In other words, the curing process has become faster. Yes. Traumatic injury is an injury caused by sudden and severe event such as a car accident or a fall, etc. etc. It is a very, very complicated thing. Multiple fracture, sometimes damage to the shape of the structure of the body as well as physical features. Yes. What are the medicines we do? Arnica general medicine. Sir, arnica 30 something. According to the condition, we give arnica 200 or arnica 100 as the case may be. Muscles, tissue, internal hemorrhages, arnica will help. Internal hemorrhages, arnica 200 is sufficient. 100 is not required. But if it is more than that, arnica 100. Shock, anxiety, dry cold wind. That is, he had a fall. Nothing has happened. He had anxiety, whether I have bone fracture, results say I am alright. And he is under mental shock. And he feels dry cold wind all the time. For thus we all know the medicine, aconite suddenness, aconite suddenness. Trauma in general, belly spasms, synovial bruisa, joint spaces, etc., getting bruised or damaged. I told you, when car accident or something like that, there will be bruises all over the body. That means the dryness prevails. Of course, we apply calendula externally. Bryonia alba can be given along with some indicated drug. Zinc vital, if there is a bone fracture or bone problem, should never be forgotten. Spine and back injuries, colossus, cuts, abrasions and bleeding, calendula abscinalis. Glands and breasts get damaged or affected, cornea along with indicated them. Lung tissues damaged, hypericum. Veins, passive bleeding, hemorrhages. I told you, whenever there is bleeding in any orifice, there are 9 orifices in the body. Bleeding in 9 orifices, hemorrhage is a very beautiful remedy. Just like a aconite, just like a rescue remedy in the flower medicines. Hemorrhage also beautifully helps us in arresting the bleeding. Suddenly you get nose bleeding. Suddenly you get bleeding in the eyes, or when you cough, sputum, blood comes in, or when you pass urine, blood comes in, or when you have motion, blood comes in. So hemorrhage is the best medicine that you can never forget about, because it's a very, very beautiful and indicated remedy for all of us to follow. Yes. These are all the refreshing, expertising your knowledge, enhancing your knowledge. Yes. We have got different approaches in homeopathic field. That is why homeopathy differs from all the system of medicine in teeth. There are specific symptoms are there. That flatulence, China Lycopodium carbovix. Fear, aconite opium arsenicum. Sora. So how do I know Sora said? When his skin is revealed or when his mouth ulcers are there, when he feels his sputum and other things are offensive, etc. etc. Sora means sulfur sorinum graphitis. These are the specific indicated symptoms that we should never forget. And whenever you see a patient completely giving those symptoms, these medicines should reflect in your mind. Reflect in your mind. Psychosis, Thuja medorinum natrum sus. Thirstlessness, pulsatilla, apis, ipecac, bryonia, etc. Famous left-sided remedies, lachesis, Thuja, apis mellifica and Thygelia. Vomiting during travel, petroleum, cockles, carbolic acid. One time I have been only giving cockles only, but the patient has not shown any improvement. Then I have given him the carbolic acid. That helped, but immediately I switched to petroleum. After 2 weeks, I switched to petroleum. It has thoroughly cured the patient and he was not getting any vomiting during travel. Even adults also now vomit. Whooping cough, Drosera, Pertussin, Belladonna, Spongia, etc. etc. Now we have got a medicine for whooping cough also prepared from the very same machine. Delirium, Belladonna, Thamonium, Hyoscyamus. Convulsions, Camphor, Fibrum metallicum, Cicuta virosa. Sweating on the head, Calcarea calm is the indicated term. Silesia, Calcarea fast. Intolerance of potato, Thuja alumina cholecystitis. Sir, if these medicines are given, do you overcome the intolerance to potato? Yes, definitely. It will correct the stomach ulcer. Along with that you give lycopodium. Along with that you give carbo-vegetable for easy digestion. It will definitely help. Aggravation 4 p.m. to 8 p.m. You all know the answer. You all know the answer. We have been repeatedly telling you. Lycopodium, Chelidonium, natrum sus. Aggravation at 3 p.m. Belladonna, apis mellifica, Thuja. Emaciation, natrum rube, sarsaparilla, iodine. Constipation due to inactivity in the rectum. Inactivity in the body, not that. Inactivity in the rectum. Alumina, veratrum album and Silesia. Bearing down pain, Belladonna, Lilium tigridum, Sepia. Cramps, Fibrum metallica, Cholecystitis, Macphus and Caustica. Bruised pain, Arnica, Hippodorium perfoliatum and Baptisia. Shifting pain, that is, it shifts from one place to another. Pulsatilla is the head remedy. Pulsatilla is not only that. You feel that very simple pitching, like needle pitching, needle pressing in the skin, pulse comes in. Lac canina, tuberculosis, yes. Hypersensitive to pain. Hypersensitive to pain. Like even little pain, he feels very much troublesome. Aconite Chamomilla coffea. Hypersensitive to touch. Touch. Hepar lachesis China. Now you see the difference between these two. Hypersensitive to pain. Hypersensitive to touch. The medicine differs. That is homeopathy. That is homeopathy. Sir, how do you remember all those things? As I started this homeopathy, you should have started this clothing. You were 40 years, 50 years like that. Yes. I do admit. Only when you are able to have desire for this, you should start. You ask all your friends who are all interested in homeopathy to join the elite club. Whether they are 40 years, 50 years, 60 years, advocating. You ask them to join. They can be easily be benefited. A famous doctor was speaking in a lecture how to make yourself comfortable. Avoid going to hospital. The very first word he said, avoid going to hospital. Not physician, hospital. If you go to hospital, they will say, first all checkups, then different specialist comes in. Every visiting fees is count. By the time you come out, you are given 1 lakh bill, that itself will give you a heart attack. Breast pain before menstruation, Tuja lac caninum ponium. Throbbing pain, Belladonna bromine millilotus. Eye strain related to problems. Ruta is the best medicine. Ruta is the best medicine. Those who are now watching TVs, working in computers, working in WhatsApp, Ruta is periodically taken. And take Euphotorium or foliatum. Euphrasia, plain drops. Once in 2 times or 3 times in a week. Can you avoid going to the WhatsApp? Can you avoid going to the TV? At this age it is impossible. Because we only depend on that. I too. So I used to take twice in a week Ruta, and once or twice I will have Euphrasia drops. Emaciation from upper body to lower body. Emaciation, that is, you feel helplessness, weakness from upper body to lower body. Upper body somewhat better, but going down, you feel very, very uneasy to even to get up or walk or do emaciation because of the weakness of the joints and muscles. Methanol, Lycopodium, Sanicula, etc. Cracks at the corners of the mouth. Nitric acid, chondrographitis. We have been telling you chondro. These are all if the cracks and eruptions in the lips comes in. It is an indicator of flora in the body. In the child, it mostly happens in children. Urine leaks during coughing. Causticum pulsatilla natremum. Drowsiness, opium, antimonium tartaricum, lux moscata. Like that. There are humpty number of matrices. We can take the entire 2 hours for giving you all this symptomatology, grouping ways. But if you are interested, I will put them into your WhatsApp so that we can preserve it for your useful practice. Thank you very much. I will hand it over to Dr. Murthy sir. Thank you. Murthy sir?
Yes, sir. Thank you, sir. Thank you, Surendra. Suresh Kumar. Hello, Mr. Suresh Kumar.
Yes, sir.
Sir, you can take. After you are taking, I think today Republic Day, will at least half an hour before we close.
Okay. Very warm good evening to all the members in this group, and my greetings and best wishes on the eve of the Republic Day to all the members. And we'll go into the subject particular. We're continuing with the therapeutic index, the important first line remedies for given disease condition. So with this, last Sunday we saw stopped with the situation trauma. What are the trauma remedies we saw it, and today we'll go into the next in series. The disease is tuberculosis. So tuberculosis is a bacterial infection, and that affects the lungs, and it is caused by the bacteria called Mycobacterium tuberculosis, and it can attack any part of the other body. Not only the lungs are affected by tuberculosis, but it can affect the other parts of the organs, kidney, spine, brain also. And the mode of transmission is normally by coughs, sneezings, and speaking also. So it is basically commonly seen as a lung infection also. And what are the remedies meant for the tuberculosis in our homeopathy? So prime remedies, the first we think of always is, in this condition, is phosphorus, and then we have Drosera, then Calicarb, then Stannum metallicum, Spongia, then Silesia, and then we can think of as a constitutional remedy also tuberculinum, which is nosode. So these are some of the prime remedies, first line of remedies for the condition tuberculosis of the lung. I repeat: phosphorus, Drosera, Calicarb, Stannum metallicum, then Spongia, Silesia, and tuberculinum, and these are some of the remedies we can fall back for the tuberculosis. Then next disease condition is tumor. Tumor is a very large area of discussion, and which has got a malignant tumor, non-malignant, benign tumor. We are not going to depth of instead of going to pathology of the tumor, we will see what are the primary remedies for the tumor conditions, non-malignant. So the important remedy for tumors are conium, Phytoleuca, Calcarea flor, then Hydracetes, Carboanimalis, Calcarea carb, Thuja, Plumbum iode,
Baryta carb, then Lepis albus, and also Hecla lava also. Hecla lava also can be thought of in case of some of the tumors. So these are some of the prime indicated remedy for tumors. I repeat: conium, Phytolacca, Calcarea floor, Hydrastis, Carbo animalis, and Calcarea carb, Thuja, Plumbum iode, Baryta carb, and Lepis albus, and Hecla lava. So these are some of the first line of remedies we can fall back for the given condition. Then so this I want to add one more information. Tumor is from pathological angle is neoplasm. Tumor is a neoplasm, and it is an aggregation and accumulation of the abnormal cells in our body, and it can affect the tissues, it can affect the glands, it can affect the organs, even skin, as well as the bone also. So these are the few additional information about the tumor. Then coming to next disease condition, typhoid. So again, this is also a bacterial infection, and that spreads to mostly by contaminated water and food also. So, and the causative organism in typhoid is Salmonella typhi. The bacterial influence, that is Salmonella typhi, is an organism which causes the typhoid, and the mode of spreading is through water as well as food also. So what are the important prime remedies for typhoid? So we can think first as a bacteria, then Arsenica album, Bryonia, Rustox, muriatic acid, China, acid phos, and pyrogen also. So these are some of the important remedies prime remedies we can think of for the given condition. I repeat: bacteria, arsenic album, Bryonia, then Rustox, muriatic acid, China, acid phos, and pyrogenum. Pyrogenum is a nosode, so we can think of in extreme circumstances or as a need arises for a given condition. As I always say, whenever we think of nosodes, we have to use as a constitutional remedy, and we have to think twice before using nosodes, because they are double-edged razors. So nosodes, though they are very effective in curing and bringing cure in disease condition, but let's remember they are double-edged razors also. So let's not be afraid of the thing, but we have to keep in mind always. So whenever we are using nosode, we have to think twice. And the next disease condition is your, in alphabetic series we go to ulcers. So what are the prime remedies or different remedies we can think of as a first line of defense for the ulcerations? So the prime remedy, always we have a very ready remedy, trauma remedy is calendula. It's a very, very helpful remedy in ulcerative situations. Calendula, arsenicum album, nitric acid, then agendum nitricum, chalybeate, graphitis, phosphorus, moxar, hydrastis, and then Silesia lachesis. These are some of the important remedies we can list down for ulcerative conditions. And ulceration is a breach in the continuity of the skin, particularly epithelium and mucous membranes, caused by the inflammation of the necrotic tissues. So on account of the inflammation of the necrotic tissues, this phenomena arises. So once again I repeat, the important remedies for ulcerative conditions are calendula, then arsenic album, then your Argentum nitricum, Chalybite, and Graphitis, phosphorus, Maxol, Hydracetis, and let's not forget nitric acid and Silesia also. So we can also think lactic acid also for the ulcerative situations. So I again repeat, calendula, arsenic album, Argentum nitricum, Chalybicum, Graphitis, phosphorus, Maxol, Hydracetis, nitric acid, lactic acid, and Silesia. So these are some of the important remedies for the ulcerative. But apart from this, I am giving you one more new remedies, very rarely used remedies, uncommon remedy, but very available in the market also, is with SBL. And this new remedy for ulceration is known as Arbus precatorius. There is a new remedy. You can go and Metal America and see. It is known as Arbus precatorius. ARBUS, Arbus precatorius, PRECATORIUS, Arbus precatorius. It is given for various ulcerative conditions also. It is used for corneal ulcers also. This Arbus precatorius is very prominently used for corneal ulcers also. So we can think of this rare remedy also. If necessity, we can use this rare. But we have got a humpty number of first line defense remedies. Rarely we will use this Arbus. So still we have to remember some of the important remedies as well as some rare remedies also, which will be very handy in some extraordinary situations. So ulcers are this. Then in ulcer, one information more I want to add, because very commonly we come across in clinical conditions peptic ulcer, which is the ulcers that develop in the lining of the stomach and lower esophagus and also small intestine also. Usually it occurs because of the erosion on account of excess secretion of stomach acids, and also it is caused by the bacteria H. pylori. So Dr. Anup has discussed this in his presentations, and so peptic ulcer is a damage to the gut lining, particularly upper GI tract and esophagus, small intestine, and lower esophagus, intestine, and stomach. So I would like to bring here some of the important remedy for the peptic ulcers too. Just now I have spoken some of the important remedy that also finds in this Argentum nitricum, Nux vomica, Chalybicum, Lycopodium, Carbovex, Graphitis, phosphorus, Hydracetis, arsenic album, and these are the prime remedies for peptic ulcer. But some of the rare remedies we use: uranium nitricum, bismuthum subnitricum, and geranium maculatum. These are the secondary line of defense or the rare remedies we use in such conditions. But primary remedies for peptic ulcer is Argentum nitricum, Nux vomica, Chalybite, Lycopodium, Carbovex, Graphitis, phosphorus, Hydracetis, natrum phos, and arsenic album. And among the rare, I repeat, uranium nitricum, bismuthum subnitricum, and geranium maculatum. Geranium you use in case of when there is a hemoptysis is there, when ejection of blood is observed in sputum as well as vomits. So in such situation we can think of geranium. Also ornithogalan. The ornithogalan can be also thought of in case of a blood vomiting situation. And but Prime remedies remain argentum, chalybeate, lyco, carbovex, graphitis, nitroglycerin, acetic album. These are the very important remedies as first line of defense remedies. Coming to next situation, urinary disorders. So many times this topic has been discussed under the various diseases of the bladder, various situations of the kidneys, urinary tract infections. So many times, various situations we have discussed this. But just quick recapitulation of the important remedy for urinary disorders or urinary tract infection. Prime remedies are Cantharis, Apis, Barberis vulgaris, then Terebinthina, Sarsaparilla, and Apocynon, and Pereira brevia. These are some of the prime important remedies we can think for urinary disorders or urinary tract infection. I repeat, Cantharis, Apis, Barberis vulgaris, and Apocynon, Sarsaparilla, Terebinthina, and Pereira brevia. So these are the some important prime remedies for the urinary disorders, or we can tell about the urinary tract infection also. With this, we will give pause today. It's 5 o'clock. We'll cut short our talk today half an hour before, because we would like to relieve all members on the eve of the Republic Day eve. So I hand over to Dr. Moti.
Thank you very much, sir. Namaste, my dear homeopaths. Today, since because it is a Republic Day, at least half an hour leisure you take and go anywhere and enjoy. One question shall I ask? Suresh Kumar, when he is telling his lecture, the last 2 minutes back, he has told one medicine, Ornithagalum. Ornithagalum, very rare remedy. What for? Ornithagalum is meant for malignant, benign or malignant condition in the stomach. The main symptom is the person will not have any appetite. So without eating anything, the person will deteriorate and he will be abnormal pain in the stomach and constant indigestion will be there. For all those things, Ornithagalum umbellatum. The drug is very good and you can use sometimes with any person, that too above 65 or 70, the person is suffering with stomach problem, chronic stomach problem. You can give 1 or 2 doses of it and start with next Carbovage or Naxonica. Don't forget, after Ornithagalum you have to give Carbovage or Naxonica. Thank you very much. Next month, next week we will meet. Thank you, sir.